Welcome back to the Means Report, everybody. Learning about portable ultrasound today, and the best way we think to do it is to talk about it as we did during segment 1. And now to demonstrate it here in our second segment, Dr. Lyon and Becky are here to show us how to do that, along with the most important member of our team right now, Valin Antoine. Valin is a fourth-year medical student, and you've been studying this pretty much your whole time in med school, right?
Correct. So for the first 2 years, it was more so for just learning anatomy and making sure we knew how to understand the probes and understand the processes, but now in my third and fourth year, I'm actually using it on patients in the emergency department.
And I'm so sorry that I ignored Amy, our patient. She's going to help us out today. Amy, also an MCG medical student, and thanks for your help today. Let me ask you this. First of all, Dr. Lyon and Becky and I were reminiscing about the old days when the equipment was big and bulky and expensive, and is this just pretty much for a younger person, if you will, the way things should be, or does this fascinate you at all?
It really fascinates me how small it is, and I was just looking at the image. It's really clear, and I think it's pretty cool, in my opinion.
Well, why don't I let you get to work? Tell the viewers what they're going to look at and what they're going to. This is an Android device, or this is compatible with all Android devices, this portable ultrasound unit. Even a phone, Dr. Lyon?
Even a phone.
So you could just plug it in out there in the field or the hospital and check things out. All right, so I'll let you get to work, and you just sort of tell the viewers what you're doing and what we're seeing.
Okay, sounds good.
What part of her body are you checking out?
She's looking at actually the heart on the screen here. We're looking up from the, it's called the subcostal area, looking through the liver to see the heart. You can see the valves and the motion of the heart.
Yeah, keep it right there, Valin, if you will. Becky, excuse me for interrupting you. Marlena is going to get a good shot of that monitor so we can see Amy's heart beating. We hope that it's beating. Oh my goodness gracious.
Here, yeah, you can see her liver at the top of the screen, and down below you see her heart beating.
Point to the liver, if you will.
The liver is right here at the top, and then down below that you can see her right ventricle and her left ventricle, and everything's working perfectly on our healthy, normal model.
Tell you what, Amy, you're the first med student who's been comfortable letting somebody look at their liver, much less on television. Kidding. Joking. It looks good. It looks good. And what about the clarity of this versus the kind of machines, doctor, that we were talking about? Just as good?
Well, not as good as a machine that costs 10 times as much, but it is very good for doing what we're doing at the patient's bedside, finding out things that, again, would affect the treatment right here and right now. So it's good enough for that.
Oh, and we talked about confidence and accuracy, Valin, with Dr. Lyon a moment ago, and with Becky. How confident are you in what you see, and how confident are you in your ability to at least start to make a diagnosis based on this?
Absolutely. So over time, we get more comfortable, of course, with practice. Like they said, it is a process in learning exactly how to navigate the probe and understanding what you're looking at. But my few months, at least with the ED, has been awesome. I feel I'm getting a little better at it.
What other parts of the body can you look at? I don't want to put gel on her head, but could you look at her brain if you wanted to?
Sure, you could look at her brain through her eye.
Okay.
So it's very common. We can look through the brain and see the sheath that holds the nerve behind the eye. It dilates with intracranial pressure, so you can look to see if somebody is having a head injury. You can look at their abdomen. You can look for the liver, the spleen, the kidney, see if they have kidney stones.
That's the one where the dilation, if you hold your nose and keep your mouth closed and blow, that's a good way to tell if someone's been hurt.
Well, it's an experimental technique, but it is a way that we can help know that somebody has had a head injury.
Can you hold it up to her eye and see what happens?
Sure.
Okay, yeah. All right, Marlena, take camera 8 again, if you will, and show the shot. I just want to see. And Amy, don't let us make you uncomfortable. Don't let us make you more uncomfortable.
Just don't open your eye.
All right, so we're going to attempt to look into Amy's soul. Isn't that what the eye is the window to?
It is.
All right.
Yeah, what are we seeing, Dr. Lyon?
So typically we use a little bit different transducer for this, this exam, but what we're seeing is this black area up here is her eyeball itself, and Becky can tilt back and forth, and what we see is the structures behind the eye, and one of those structures is the optic nerve itself, and the optic nerve has fluid around it, and the same fluid that's around the brain.
Which is good.
Which is great, but it's a way, this is that nerve coming through the back. That's one way, though, we can look at the size of that sheath, and it dilates as pressure goes up. And so we can use that to help us know that somebody has had a head injury and they have elevated intracranial pressure.
Okay, go back real quickly to the insertion of the lines or the tubes
Sure.
with the patient. How do y'all practice that? There aren't Amy's lying around on every table at MCG. How do y'all do it?
We use something called an ultrasound phantom, which is essentially a gel block, a block of gel that has artificial veins in it, and we practice putting needles in that. So it's kind of like a skill that you have to learn, and you don't want to learn on a patient, so you use an inanimate object to help you.
That is absolutely fascinating. How much is that?
Well, the price varies based on the companies, but you know, a good rule of thumb would be about 5 to 10% of a normal standalone ultrasound machine.
That's a tremendous savings, and I will use my microphone for this. I don't want to end the segment without you getting to talk. Are you all right?
I'm good.
And your brain and your heart appear normal. That's got to be reassuring.
Yeah, that's good.
What year are you in school?
Oh, I'm not a med student.
Okay. I told the viewers you were a med student. I take back the first part of this segment. If you could just delete that part. What?
I'm more of an animal person, so I'm
She's
going
a
for
standardized patient.
Yeah, I'm a standardized patient for MCG.
I got you. So you do this a lot.
Yes, I do.
Well, we appreciate you volunteering for us today, Amy. Amy was a good sport for sure, and she helped us learn a lot. And all of you, Valin, best of luck with the rest of med school for you. And thank you all, Dr. Lyon, Becky, for being here. I've learned a ton. Any idea where you're going to go next?
Well, I'm hoping to stay here.
Yeah.
We'll see what happens.
That'll be determined on match day, right?
Yes, it will.
Okay, all right. We'll keep our fingers crossed for that. And thanks again to everybody. Wow, how technology has changed in such a short time.